Welcome back to Friday Q&A series, where I am back here to answer the questions that you had asked me in the comment sections. So let's start with the first question for today, which is asked by Mr. Satyanarayan, who is asking, I was diagnosed with grade 4 Bell's palsy. Not much visible changes on the face. Eye blinking is not complete. Excessive water dropping from my eyes. Slight left side mouth abnormality is seen while smiling. Doctor prescribed galvanic stimulation. Went for one session. Shall I continue further? Please guide. Thank you, Mr. Satyanarayan, for your question. Since you are suffering from the acute phase of Bell's palsy, we generally don't recommend electrical stimulation to any of our patients because we believe that in the initial phase, you have got the highest opportunity of natural recovery. What's more important for you is to take your medication on your time, to take care of your sleep cycle, take care of your diet, nutrition, mental health, and rest. At the same time, focus on doing facial rehabilitation in a better way than going for electrical stimulation. I hope this helps. Alright, so now the next question is from Mr. Durga Prasad, who is asking how many months to recover from Bell's palsy? Well, Bell's palsy recovery can vary individual to individual. Having said that, the normal timeline or else a common timeline of Bell's palsy recovery is 3 months. So if you are someone who is suffering from Bell's palsy, then you should definitely wait for this 3 months of timeline for natural healing to happen. But that does not mean that you don't take your medicines, you don't do anything. You need to take your medicines on time. That's absolutely important. You need to take rest, you need to take care of your body, and most importantly, you should do your facial exercises in the right manner. I hope this helps. Alright, so the next question is from Ms. Jia Solanki, and she's asking, ma'am, I am in synkinesis stage since 4 years, doing the exercises that you are telling, but still no result. What should I do? Please make a video on this because I can't reach out to you. Well, Jia, you can definitely reach out to us. Our contact details are always mentioned in our description box. But if you want me to tell you about how to work on the synkinesis, well, the videos that I personally make on this channel is for an educational purpose only. Synkinesis, even though looks same, is very different individual to individual. It requires a very personalized approach, and that's why we cannot create generic exercises and can hope for complete recovery or complete outcome. We need to identify which muscles are at fault for you, identify the wrong patterns that are there in your face, and then only we can help you out. I hope this is clear for you through this answer. Alright, next question is from Aditi, and she's telling very useful, clear and detailed information and explanation. Thank you so much, Aditi, for your kind words. Fathama is telling good help. Thank you so much. Alright, so now the next question is from Northeast Chala, and he's telling, please reply, I have 4-year-old Bell's palsy. Well, whether it's 1-year-old Bell's palsy, 2-year-old Bell's palsy or 4-year-old Bell's palsy, you can work on your facial rehabilitation at any stage, at any time. All you need is a precision in terms of understanding which of your muscles are not functioning well, which muscles are overactive, which muscles are underactive. And based on that, we have to create a personalized rehab protocol that suits you. I hope this gives you an understanding. Alright, the next question is a very interesting one, and this is from Francis, and she's telling, is it possible that on a droopy face with older Bell's palsy, muscle weakness and tightness can happen at the same time? Thank you for this question, and yes, it's very much possible that the tight muscle can be weak too. A muscle that is tight is not functioning enough to create a movement. But that doesn't mean that it is strong enough to hold a movement. It's just overfiring. Your nervous system is holding that muscle in a contracted state for a long period of time and is not allowing to relax or get free, which eventually leads to weakness. So yes, it's true that when your muscle is tight, it is weak too. I hope this gives you understanding. Alright, now the next question is from Chuang, and she or he is asking, my acute Bell's palsy started since day before yesterday. How many times do I have to do the facial exercise in a day? Chuang, your facial exercise should be no more than twice a day. The less you do the exercise, the better it is. Yes, exercises are absolutely important, but over-exercising can cause more damage than good. I hope this helps. Alright, the next question is from Syed, and he's asking, good morning ma'am, my present paralysis patient has smiling problem. His left side moves more than the right side. What should be done? Well, in this particular situation, what's happening is the non-affected side is more overactive, and that's also a normal phenomenon. You can say a natural pattern that builds up over a period of time because your good side of the face tries compensating the affected side. So in such scenario, the first thing that we should do is we should try to reduce the contraction on the non-affected side first, which means you need to underdo the movements on the good side and then retrain the muscles on the affected side. I hope this helps. The next question is from Mr. Riju Das, and he is telling, ma'am, can you please suggest me some eye exercises to recover from post-Bell's palsy? Whenever I smile broadly, my eyes is closed. I'm suffering from this condition from 6 months. Well, Mr. Riju Das, you are having synkinesis for sure, but again, which muscles are getting involved in synkinesis is something that we need to see, and then only we can suggest you. One of the best thing that you can do to work on your synkinetic eye is to do eye massage. So make sure that you do gentle stroking over these eye muscles in a circular direction like this. You can apply warm compress, and you can try looking in some other direction while your synkinetic movements are happening around the eye. These are the 3 tips that I would like to give to you so that you can work on your synkinesis around the eye. I hope this helps. Alright, so this is the last question from today's series, and this is by Mr. Ravi. He's asking, ma'am, I'm 34-year-old. After one night journey, I had happened to sleep for a long period. When I woke up, and while drinking water, I observed water was oozing out through the corner of my mouth. I lost control over smiling evenly. Couldn't lift my right eye along with the left. While talking, only left side is okay. I'm not sure it's Bell's palsy, but still there is numbness on my right side of the face. Please help me. Well, in this case, Mr. Ravi, you should see your doctor as soon as possible. Please don't delay. This is serious. You can protect your nerve if you take your medicines on time. So don't rely on exercises or anything. First, take your medicines. Alright friends, so these were the questions that came to me on my comment box this week. If you have any further questions, feel free to ask them in the comment section below so that I can read it out loud for you. On that note, I'll end this video here and I'll see you in another video. Thank you.